It's time to take 5. Now you know.
We're visiting Palm Beach Children's Hospital at St. Mary's Medical Center, a Palm Beach Health Network hospital. Today we're speaking with Dr. Matthew Dobbs, a board-certified pediatric orthopedic surgeon, about treating clubfoot in children. Doctor, you are a pediatric orthopedic surgeon who specializes in clubfoot. Tell us more about this disorder and how it affects children.
Clubfoot is a very common disorder. It's actually the most common inherited musculoskeletal birth defect. It affects about 1 in 700 births around the world. There's one part of the world where it occurs about 10 times more frequently, which is in the Pacific Ocean. So Hawaii Islands, Samoas, New Zealand, and they thought to be a genetic basis for this. And in a lot of our families that we see here, they do come in with a positive family history. So there is a genetic basis for at least some clubfoot that we see. And if those of you that haven't seen a clubfoot or know what it is, if you took a child and simulated weight bearing, you would be walking or standing on the tops and outside of your feet. So the end of the feet look like the end of a golf club, hence the name, clubfoot.
What type of treatment do you offer for clubfoot?
We like to treat children as early and as young as we can, and we offer the Ponseti method in those children. And this is a minimally invasive method which really has outstanding results. It does take some time to go through the treatment process, but it avoids large surgeries and the scarring, pain, and problems that those can occur. The Ponseti method consists of casting and gentle manipulations, which are just done in the office. So we take a baby, we bring them in, we gently manipulate their feet to correct the deformities, and it's a slow process. And we manipulate for about 30 seconds to a minute, and then we put on a plaster cast, an old-fashioned plaster cast, to hold that correction for that week. A week later, we change the cast, and in the young children, their feet and tissues are pliable, so the next week we get even more correction. And it's an extremely visual process for the parents. They can really see the deformity correcting and what's happening, and they really start to buy in to the treatment process. It takes a total of 5 casts to correct the club feet. So this is done within a couple of months. The problem with this clubfoot management is the treatment doesn't stop there. Despite the feet looking really great at that point, the deformities will recur if no bracing is done. So the children do need to wear a particular brace. It's a shoe and bar brace designed to maintain correction. The analogy is using a retainer after you've had braces to correct your crooked teeth. The braces for clubfoot maintain correction, and they're worn at nighttime for the children up until the age of 4 years. So you can see it is definitely a treatment process that requires some investment on everyone's part, but the outcomes are tremendous.
What advice do you have for patients who may be reluctant to have treatment?
Seek correct medical care. So don't be confused about what you may Google. You're going to see a lot of stories of children that have undergone invasive surgical procedures and end up with feet that may be painful, arthritic, and not such a good outcome long term. I want parents to know this is not the treatment that is offered. The gold standard is the Ponseti method, and with this treatment, your child is not going to hurt. They're going to have normal feet long term. They wear normal shoes, they play sports, and there's no limitations whatsoever.
Why should families choose Palm Beach Children's Hospital?
We have a unique setup here. We're in a group of subspecialists in orthopedics, and we have developed here a one-of-a-kind clubfoot center that treats patients. It's the highest volume in the country, and we treat patients from all 50 states and over 100 countries. So this is truly the state-of-the-art clubfoot management. And we focus not only on offering the state-of-the-art clinical care, but we're pioneers on the research side as well as educating the next generation of clubfoot practitioners globally.
Thank you, Dr. Dobbs, for all of this helpful information. We hope everyone understands it's important to take care of your health. And if you need treatment, please don't hesitate to go to the hospital. The doctors, nurses, and staff at Palm Beach Children's Hospital are there to keep you healthy and safe.